Yeah,
Yes,
Syed Farhan, are you ready?
yes, I'm ready, sir.
Okay, yes, getting ready. Yeah, hello and welcome to Seven Sentinels. This is Grand Master Class, and I'm Peter Simon with you. Today we are conducting a speaking role play session for Dr. Syed Farhan Ahmed, currently in Wakra, Qatar, and originally from Chennai, Tamil Nadu, India. Yes, medicine specific. These are the daily dosage profession specific speaking materials and medicine profession specific speaking tasks. This is the task. So you are ready with the task.
Yes, sir.
So
I'm
you
ready.
can, yeah, once you are ready, you can start.
Yes, sir. Good afternoon, sir. I'm Dr. Syed Farhan Ahmed, your consultant physician for today. How can I help you?
Yeah, good afternoon, doctor. I have brought my 2-year old son to you so that you can study his case. His general health has been good and he has no illnesses or medical conditions earlier. But I want you to just have a check on him.
No. Okay, good to know. But before proceeding, may I know, do you have any specific concerns regarding your ward?
Yeah, doctor, not one, many, multiple problems.
Mm,
My child's appetite has been poor. He never finishes his plate of food and he dislikes many foods. He drinks
mm,
plenty of milk and sugary drinks and sweet sugary drinks. I don't know what's the reason for him. Why is he not eating properly? And his
mm,
eating habits are very poor. I am worried about his weight.
mm. Okay, I appreciate your concerns, but before proceeding, may I know, because of his eating habits, has it really affected his behavior? How is his behavior in general at home?
No, everything is fine. I don't have any complaints otherwise. It's just his food. It is his growing age, and I think
Mm,
he has to eat plenty because all the food he takes, it goes on to build his body. And this is the age,
mm,
tender age. Okay, if he
mm,
doesn't eat properly, how can he build his body?
mm. I understand and I appreciate your concerns. You really seem to be very caring. It's good to know. Before that, your child actually looks, for me, he looks healthy, physical wise. If you don't mind, can we check his weight and height? I think that
Yeah,
that.
health wise and other things, body wise, everything is normal. But I'm worried about the future. Okay, you can do whatever test you want. So, yeah, test. Okay, what is the nature of the problem? Okay, you
Mhm.
can just check it out if you can.
Okay. So yeah, I've checked his weight and height. Apparently, he has a normal weight and height for his age, as plotted per in the graph according to WHO standards. He's perfectly healthy. Before that, I would like me myself to explain you the dynamics of food consumption among young children. I hope you have time for that.
Yes, of course, doctor. I am okay with all those things, but I want to know if there is anything that I can do to improve his appetite. I don't want
Sure.
to decrease the amount of milk and sweet or sugary
Mhm.
drinks he consumes because I'm worried if he doesn't have these things, then he won't eat anything else.
Yes, yes, yes. No, yeah, I agree with you. But firstly, I would like to tell you that your child is just 2 years of age. This is the age where it was your child breastfed adequately during his time when he was young.
Yes, doctor, that's absolutely fine.
Yeah.
And yeah, I am not okay with all these things. I think he has to eat. When I was a child, I used to
Mm,
eat plenty. My mother used to give me a lot of things, and I used to eat them even if I'm not interested. But I don't know how to manage with this
mm.
child.
It's nothing to worry, sir. He's just 2 years old. In this age, it's very common for kids to refuse food items because from their birth, they're constantly, have been fed with milk. Then I guess after 6 months, Cerelac. So and basically in all these things there is sugar. It's very sweet. So there is a sugar content in everything, so the child is actually accustomed to sweet taste. He has developed that sweet tooth, which is kind of normal. So it usually takes time for a child to develop his taste buds and adapt to particular tastes. It's quite common. But yes, regarding his sugar consumption, I would really much say that you start behaving bit strict with the child. Means you can give him small minor punishments like take away his toys. And regarding his diet, yes, what I would suggest is give him milk twice a day, which is very necessary. And regarding sugary drinks, I would say you avoid sugary drinks and you give him, a substitute. Rather, I would say you give him honey instead. They say honey is healthy sugar. It contains fructose, which is also good for the development of the child. So I would suggest you to replace sugar with honey. Milk is important, and slowly, what you do is you start feeding him with other substitutes like normal food like rice, but with it should be much softened, vegetables and few lentils. Kids, I think they once they start eating lentils, their taste buds develop. They say a recent research says that lentils contribute in development of taste buds in children. Apart from that, I guess you will be fine, sir. And there is one special this thing counseling program in our facility where they teach parents. A group of nutritionists teach parents how to feed their children properly, especially those children who have an aversion to certain types of food and are fully devoted towards milk and sugary drinks. They'll counsel you about how to deal with it. And yeah, as far as I'm concerned, his weight is normal. The way for his age, height is normal for his age. It's all in accordance with the WHO standards. I would just request you to again come for a follow up after 4 weeks. I hope it's fine with you.
Yes, doctor, that's absolutely fine. Yeah, I accept your advice. I'll follow your suggestions. That would be fine.
I hope I was clear and assuring. Not.
Yes, of course, doctor. Thank you very much.
You're welcome, sir.
Yeah. So now coming to the point, let me give
Yes,
you some details.
yes, sir.
Yeah, just your phone, and you can just listen to me for a while. Afterwards, if you have any doubts, you can unmute and you can speak.
Okay.
Okay. So, yes. Okay. So that's a very good. Let me give you some feedback. Yeah, you are doing very fine. In the beginning, yeah, you are a little, hesitant in the beginning. So you are trying to elicit a lot of information. That's absolutely fine. There is no problem with you, and you are definitely doing well. So the way how you are handling things are perfect. So, but the way how you are asking, you can instead of one sentence, you can double the sentences. For example, so I definitely understand your concern. If I were in your place, I would also have felt in the similar way. And being a parent, worrying about the children for not eating adequate amounts of food is a bothering thing. And I certainly am on your side. But the thing is, why do you think your son is not eating properly? What, according to you, is the major reason for this? Do you have any idea? If you feel that there are certain reasons, okay, you can definitely um, you can definitely share your points with me so that we can um, you know decide what course of action we can take, because you have been seeing your child for quite some time and you know his habits. So you can tell me the present condition and the background reasons or your imaginations or observations. And if you can tell me all those things, yeah, I can definitely discuss with you what are the possible options that we can go ahead with. So the best and come out with the best possible solution to handle this situation. So that is one. In the beginning, I have given you a number of sentences. You can use at least one or two, or at least three. If you want, you can use four or five also. But so because you have to make him feel, come out and feel. Okay, right. Just instead of saying, "Tell me about why," tell me about your concerns. Tell me a little bit more. Instead of that one, you can just you push yourself into the topic and get involved deeply and melt his heart to give out his points. That is the initial stage. Then next one, after telling, yeah, your observations are quite reasonable, might be true to some extent, but might not be true 100% also. Partially, what you presume the reason, your presumptions might be definitely true to some extent, not 100%. Okay, chances are there, most likely. But the thing is, there are quite many reasons. Okay, quite many reasons. Children are playful. They want to spend every second playing and enjoying and dancing and eating for maybe 5 minutes to 10 minutes, sitting at a place and eating. They cannot have that, focus. They cannot concentrate on food. Even while eating, they'll be jumping and dancing. Yeah, that is playfulness, childishness, and we cannot disregard this option. Yeah. So allow him to enjoy and don't force him or compel him to sit at one place and eat, then afterwards go and play. No. Children and play, they are inseparable. Let them play, and you can be behind them and feed them. Okay. To eat three times a meal, he can have small snacks 10 times rather than three large meals. So every hour you can give, instead in between, you can be some biscuits or food or something else. So it's not necessary that he has to eat a food or a heavy meal or lunch or breakfast. So you can give him in parts. That's what you have to think. So eating is important, not necessarily large meals or at a time. Okay, at a stretch eating. So that's not reasonable. So fine. And lastly, uh, yeah, this is the way how you can speak. Is that clear? Yeah, you can unmute now.
Yes, sir. Clear, sir. Clear, sir.
You can unmute.
I'm clear. It's
S-
clear, sir.
s- To convince the patients, the in the counseling session.
Yes, sir.
Okay, so how you are discussing with him is
Mm.
important.
Okay, sir.
See, for example, what you expect from a doctor, when you go to a doctor, the same type of treatment you have to give. You should
Yes.
understand, you have to understand the pain of the person, the pain
Mm.
of the person, you have to understand the pain of the person, you should understand the heart, and you have to feel for the person, and then you have to speak. You're doing fine, there is no doubt regarding this thing. But the thing
Okay.
is, gradually, now you have to keep up the pace. You have
Yes,
to
sir. Okay.
keep up the
Keep
pace.
it.
Is
Sure,
that
sir.
clear?
Sure, sir. Yes,
Now
sir. Clear.
you can unmute, and you
Mhm.
can tell me what modifications you have to do for yourself. You can start your video. Now you can share. Okay, you can share your experience, and what are the feedback I have given you, what level you have spoken, what additions you can give, and what
Mm.
deductions you can do, and how to maximize the quality, right?
Yes, sir. Yes,
So,
sir.
this is a live session, when your body, heart, mind, and soul is totally involved, the words come natural flow. You
Yes,
understand,
sir.
right?
Yes, sir. Yes, sir.
Okay, come on. Now you share your experience.
Yes, sir. I should be. It was a good experience. It was like really helpful. I gained a lot of where to improve. I gained knowledge regarding that. Yeah, I should be more empathetic. I should show more involvement with the patient. Like I understand. I should be like, yeah, I really do understand this problem. I should make him feel that. I should really empathize with him and make sure that in such a way that he has to feel mentally and emotionally that he is at the right place. He should feel secure, and not like he's the only one who's thinking about this. I should make him, and then the way I have to speak, I should not be hesitant, I should be confident. That one thing, and the sentences which you provided, I have noted down, and I'll you surely use it the next time, because I think in this way my communication will be better, not only in this for the exam purpose, but even in future when I'll be dealing with patients, it will be beneficial to me.
Yeah. And one more thing, your exam, how many days are there for your exam now?
For my exam is on 25th, sir. So
So
I
you
think
have 3 weeks.
yes, sir, 3 weeks.
So these 3 weeks, what you have to do, 7, 3 is at 21. Yeah, 3 weeks you have. So these 3 weeks, what you have to do is, um, you can do morning one speaking and evening one speaking. You can do, okay.
Okay, sir. Okay.
And Saturday,
Mm.
you will have a full test, okay,
Okay,
continuous.
sir.
And
Sure, sir.
last one week, it will be full test every day.
Okay, sir. Okay, sir.
And now we are doing one session per day, but last
Yes.
week, last 7 days, you have to
Yes,
do
sir.
full test, warm up, then speaking task one and speaking task two, role play. Okay, both
Yes,
20
sir. Yes.
minutes, regular like session, it should be okay.
Okay, sir. Sure, sir.
So we'll fix the timing also, and so
Yes, sir.
that we can do on a daily basis, same time without any confusion. Is that clear?
Oh, sure, sir. Yes, sir.
And
Clear,
your
sir.
speaking session also fix a time, so that
Okay,
we'll
sir.
do that particular time. Now it is 1:39, so we can do every day 1 o'clock, or Indian time 1 o'clock, or 12:30, or some time. You give me your time, and
Sure, sir.
check my Indian time, and
Yes, sir.
give both your time and my time, and say
Sure, sir.
every day we'll do speaking session at this particular time, sir. Finished.
Yes, sir. Okay, sir.
Okay.
Yes, sir. Yes.
Fine. And then from next week onwards, your writing also will be live correction.
Okay, sir.
Okay, I'll give
Okay.
you live correction. You'll come and you'll sit in front of me, and I'll correct
Yes, sir.
your letter every day. Once you finish
Okay,
your
sir.
speaking, after speaking, immediately we'll do your writing
Mm.
also. Okay,
Right. Okay, sir.
writing also. Fine.
Yes. Fine, sir.
Okay, then take care.